Let's begin with the second section of treatment of prostate cancer, and in this section we will discuss the radiation therapy used for the prostate cancer, pre-radiotherapy, neoadjuvant hormone therapy. Pre-radiotherapy means before the radiotherapy is given, what type of hormone therapy can be used, and then also the short and long-term hormone therapy for the treatment of prostate cancer. So radiation therapy can be given by the external beam radiation, and radioactive sources can be implanted into gland. External beam radiation therapy, intensity modulated radiation therapy. So intensity modulated radiation therapy, safe administration of doses up to more than 80 GY gray, and higher local control and fewer side effects. So external beam radiation therapy, we can give up more than 80 grays of radiation, higher local control and fewer side effects of this external beam radiations. And then the intensity modulation radiotherapy is this external beam radiation therapy. We can control the intensity of given of radiation that can be used for the treatment. So that's the external beam radiation therapy. And then the other is when the source can be implanted into the gland. So external beam radiation therapy, radiation dose is critical. Transurethral resection of prostate. Post-radiation erectile dysfunction is related to disruption of the vascular supply. So after the radiation therapy, there can be complications like erectile dysfunction, and this erectile dysfunction is due to the disruption of blood supply, vascular supply, and then the adjustment of the dosage is important, and it's very critical dose adjustment. Bowel complications can occur, diarrhea and proctitis, and grade 3 rectal or urinary toxicities can also occur as a result of external beam radiation therapy. Pre-radiotherapy, hormone therapy that can be used is the characteristics of the pre-radiotherapy. Neoadjuvant hormone therapy is it decreases the size of prostate. So before the radiotherapy, the hormones that can be used, it decreases the size of the prostate, and it's more helpful when the radiation therapy is used. Reduces exposure of normal tissue to full dose radiation, increases the control rate and decrease the rate of systemic failure. So very, very important characteristics of pre-radiation neoadjuvant hormone therapy. It decreased the size of the prostate, reduced the exposure of normal tissue to radiation, and increased the control. So all these are benefits of pre-radiation hormone therapy. Short and long-term hormone therapy. Short-term hormone therapy is, it reduces the toxicity. So longer the hormones are used, the more toxic effect they have, more adverse effect they have. So short-term use of the hormone therapy reduce the toxicities, improve the local control rate, and the long-term treatment require 2 to 3 years, prolonged time to prostate-specific antigen failure. So the short-term and long-term hormone therapy. Short term, it reduces the toxicity and improve the local control. The long term is required for long time over a period of 2 to 3 years, and it prolongs time to prostate specific antigen failure. That's the diagram that shows the prostate cancer. And again, radiation therapy is through the external beam radiation therapy or implantation into the gland or organ, and then we can have neoadjuvant hormone therapy along with the radiation neoadjuvant before the radiation therapy. That's also helpful in reducing the size of the gland, and also it reduces the exposure of the normal tissue to the radiation. We have short-term hormone therapy and long-term hormone therapy. It also lowers the risk of metastasis. If it is given over a long period of time, the risk of metastasis is decreased. That was all about our section 2. Thank you for watching sqadia.com.